everybody, I'm Kayce, and today I'm going to be talking about the nursing community. So one of the main challenges the nursing community faces today is the stigma that nurses are only nurses because they can't be doctors and that it's an easy profession. This isn't really anything new, as it's been a challenge for the community for years. However, it still affects us today after all of those years. One of the biggest contributors to that stigma is the history of the profession. Before nursing began, way back in the early centuries, women were only allowed to work within the home, performing everyday cleaning duties and things like that. However, as wars began to increase and people started getting sicker, the role of the caregiver fell upon the women of society. They were given more duties, moving in towards the Egyptian societies and further. Even through this, though, nursing was considered a feminine profession and looked down upon. This is a main contributor to the problems facing the nursing community still, among the few others I will discuss. Within the nursing community, there are a few different ways to become certified to practice, and this can lead to quite a few different problems. For instance, to become an RN, you can go to a 2-year or a 4-year university, because they just have to take the NCLEX, which is the RN certification, and because they both have that degree, they can both get jobs as RNs, and they don't really pay different. However, there are ways that we're trying to fix that. Some hospitals are not allowing associate degree nurses, RNs, to practice. They have to either, they can be given a job, but they have to be going to school to get a 4-year degree. And then there's so many different ways to enter the nursing community. You can be an LPN, an RN, a CNA, an APN. There's so many different routes. And while it's a good thing that you can do so many things, but it can cause a lot of problems, like pay-wise and level of care. For instance, 2-year RNs aren't going to know as much as 4-year RNs, and it can cause a big difference in the level of care that they can give. Another problem facing the nursing community is the level of care between professions themselves, such as the nurse and a doctor. And a lot of people that think that doctors are, better than nurses because they've been in school for so much longer, and while they do have a better education, the nurses care for the patients hands-on all the time. They're with their patients all the time, while as doctors, they mainly diagnose and then they go to their next patient. So, there's different levels of care that the professions are giving, and it's not one's better than the other. It's, just a difference in the profession. And I think a lot of people forget that. Another thing is that nurses work a lot of long, hard hours. Many times you'll see nurses working 12-hour shifts throughout the week. And it can be through the day, or it can be an overnight shift. And, most of the workforce is working only 8 hours a day. So that can put a toll on the community, and it's one of those things that you have to really take into consideration, that these women and men are working these long hours, and yet they're still being considered, not as good as other professions, or they're being looked down upon. And that's really detrimental. So in conclusion, the idea that nurses don't deserve the same amount of respect as any other healthcare professional is absurd and really not kind of valid anymore. Nurses are hardworking, intensely caring, devoted professionals, and they're the life force of the healthcare field, the backbone. We need to destroy the idea that nursing is a lesser profession compared to like doctors. A lot of the time, nurses are, they're not at the same level of education, but they learn and they care for these people on a daily basis. And the idea that nursing is a women's profession should have been, gone a long time ago, and I don't really know why it's still considered that. The majority of nurses are women, but that doesn't mean that it's a women's profession. And once we get through these problems, then we can start appreciating nurses for the really awesome people that they are. And I'm planning to go on into nursing, so I'm really excited to, kind of move forward and get that out of the way. Okay.